Hi everybody and welcome to our presentation. My name is Brianna Kennedy and presenting with me today are my friends and classmates Rachel Mansfield, Megan Hines, and Rebecca McCauley. We are here to talk to you today about the transgender community and how there's a serious need for a transition in oral health care. Earlier this year, we attended a seminar from our friend Nolan Pike, who is an advocate for the transgender community. He opened our eyes to many barriers this community may face on a day-to-day basis, a huge one being receiving care at a dental office. This inspired us to dig a little deeper to see what we as dental professionals can do to make accessing oral health care as barrier-free for them as possible. By the end of this presentation, you'll be able to recognize language used when addressing transgender individuals, describe why there is a need for sensitivity when interacting with the transgender community, recognize the diverse needs of patients who identify as transgender, give examples of possible medications for this population, explain the oral manifestations of hormonal therapy, and describe the role that aesthetic dentistry may play in transitioning. Before we get into our presentation, we would like to cover some terminology with you. Sex refers to the biological sex you have been assigned to at birth. Intersexual is when a person is born with mixed sex hormones and chromosomes. Gender identity refers to a person's inherent sense of being a man or woman. And transgender is one who has changed or wants to change their physical body to conform with a gender identity that does not match their sex. Transsexual is an older term reserved for people who have gone through some sort of transition. This is a term traditionally used in the medical field. However, when interacting with a transgender individual, it can have a negative connotation. After speaking with Nolan, he suggested we use the term transgender when interacting with our patients of this community. Cisgender is one that identifies as their sex assigned at birth. Gender nonconforming is one whose gender expression or gender identity differs from norms corresponding to their assigned birth sex. MTF is male to female transition, and FTM is female to male transition. Here's a small clip to help you gain some insight on how the transgender community may feel when accessing healthcare.
Do I look different than the sex marker on my medical forms?
Do I look different than the sex marker on my medical forms?
Do I look different than the sex marker on my medical forms?
Does my legal name confuse you?
What are you going to call me?
How are you going to ensure I feel safe and comfortable to talk to you about my health and wellness issues?
If you're not sure what name and pronoun to use, please ask and please record it for future use.
If you call me by my wrong name and pronoun, acknowledge this, apologize, and we'll move on.
This is essential for me to feel comfortable and to access healthcare.
The transgender population is not well known in Canada, mostly due to the limited data on gender identity. The census form includes only binary gender options, male and female, with a comment box for anyone who left the question unanswered to state why they did. However, anyone who could not identify with either male or female were not included in this census. This makes for an inaccurate population size estimate. For the upcoming 2021 census, Statistics Canada is going to evaluate if there are new ways to collect data for the individuals who do not identify themselves with the present options. We found very little statistics regarding the transgender community in Canada. However, this is what we did find. A 2014 Ontario study suggests that as many as 1 in 200 adults may be transgender or transitioning. An estimated 30% of transgender Ontarians were living their day-to-day lives in their birth gender. 23% were living in their felt gender with no medical intervention, and 42% were using hormones. Having said that, we did come across some U.S. statistics regarding discrimination when accessing healthcare. 19% were refused care due to transgender or gender nonconforming status. 28% postponed necessary medical care when sick or injured. And 33% delayed or did not try to get preventative care, all due to discrimination by healthcare providers.
Transgender individuals often experience stigmatization and discrimination, which have an impact on health determinants such as social support network and socioeconomic status. A 2017 Canadian study of mental health disparities among trans youth ages 14 to 18 reported that 65% had seriously considered suicide within the past year. Many experience discrimination within the healthcare setting, contributing to limited access to care. A 2015 health review indicated that 29% of transgender individuals have been unable to obtain emergency care when they needed it, with 21 to 28% indicating they avoided accessing care for fear of discrimination. If 21 to 28% will avoid accessing care in an emergency, what percentage are willing to visit their oral health care provider regularly? Why is this important to the dental profession? As healthcare providers, it is our responsibility to be a part of the solution as the transgender community becomes more visible. We must identify barriers to care, be aware of common medications and their effects on oral health, and we should be aware of certain aesthetic procedures that may be desirable to some members of this community. Providers must demonstrate sensitivity and awareness to provide a safe and welcoming environment for their patients. A lack of provider education, fear of being outed, and fear of not receiving the same standard of care are just some of the reasons that transgender patients do not or cannot access care. There have been reports of refused or delayed treatment and distress over the need to educate their healthcare provider on their care. If they do not feel that their confidentiality can be respected, they may not reveal that they are transgender, leading to an incomplete medical history. Using inclusive, non-gendered language on paper and when interacting with patients can help them to feel more comfortable and encourage them to self-identify. It is also important to be aware of the language used even when not directly interacting with the patient. Part of our research included an interview with an advocate for the transgender community. They shared with us a story of their friend who is having a dental procedure done under light sedation, but they were still able to hear what was being said in the room. During the procedure, the dentist and assistant misgendered the patient multiple times while talking about the patient. This was upsetting for them, and they no longer felt comfortable in this office. Our takeaway from this story is to never assume someone's gender and to use pronouns such as they or them unless you have been provided with a preferred pronoun or name. The use of inclusive language on medical history and intake forms is one modification that can be made to the dental office to encourage patients to self-identify in a more comfortable manner. This can be as simple as including the following sections in the medical history and intake form: gender identity, sex assigned at birth, legal name, preferred name, and preferred pronoun. Like the rest of the population, transgender patients may not realize the significance of this information in relation to their oral health. A statement indicating the reasoning behind these questions can be included, such as, "This information is collected to provide a comprehensive, high standard of care," or "Information regarding sex is required for insurance purposes." This should be accompanied by a statement of patient confidentiality. Once this information is obtained, it should be used correctly and consistently. There is evidence to suggest that using the pronouns and names a transgender individual chooses for themselves is linked to a reduction of depressive symptoms, suicidal thoughts, and suicidal behaviors. Create a welcoming environment for all patients by incorporating all-gender restrooms and including brochures or literature in the waiting area that targets members of the LGBTQ community. Instate a non-discrimination policy that includes transgender clients and display this in the office. This should be extended to the office's website. This population is far more likely to research healthcare providers before reaching out for treatment. Reach out to a consultant in your community to provide an educational seminar which can help teach your office about appropriate and sensitive language and behavior. These are only some of the many possible suggestions for creating an inclusive and safe environment. We've provided a list of resources on our brochure for further, more detailed recommendations.
Among the transgender population, there is a higher prevalence of mental illness, predominantly anxiety, as compared with the general population. As a result, we need to be aware that this population may be treated for mental illness with medication, and to be mindful of the associated implications such as xerostomia that come along with these medications, which, as we know, leads to a higher incidence of dental caries. Some common medications that may be seen to treat mental illness are lorazepam and diazepam, which are classified as benzodiazepines, citalopram, which is classified as an SSRI, and zopiclone, which is classified as a hypnotic and is commonly used to treat insomnia. These are just a few of the many medications used to treat mental illness. In addition, people who are transitioning may be taking hormone replacement therapies. Some common hormone interventions that may be seen during male to female transition include spironolactone and finasteride. Both of these act as androgen blockers, while estradiol is a form of estrogen. All of these medications lead to a high blood estrogen level, resulting in an altered host response produced by the body. The altered host response creates an environment for increased biofilm accumulation, gingival inflammation, and therefore results in an indirect relationship between high levels of estrogen and periodontal disease. On the other hand, the common form of female to male hormone therapy is testosterone. However, we were unable to find information regarding the effects testosterone may have on oral health. During our research, we have found that there is an association between hormone replacement therapy and bone mineral density level. In saying this, an increase in BMD has been associated with male to female individuals taking feminizing hormone therapy. However, there is no link between masculinizing hormone therapy and BMD levels. For some members of the transgender community, appearing on the outside as their felt gender can be incredibly important. There is a perception among aesthetic dentistry where feminine teeth appear to be more round, as you can see in the top photo, whereas masculine teeth appear to be more square, as you can see in the bottom photo. In saying this, feminizing the teeth is a well-known OMFS procedure among individuals undergoing transition. Other procedures that may be seen in an individual who is transitioning are softening the angle of the mandible, as you can see in this next photo here, genioplasty, as you can see in this photo here, as well as softening the angle of the mandible, forehead remodeling, as you can see in the second x-ray, the forehead is much smaller than the first x-ray. Rhinoplasty, which you can see here in this photo, is remodeling of the nose bone. And in this photo here, thyroid chondroplasty, which involves shaving down the thyroid cartilage to reduce the appearance of the Adam's apple, or to add implants to create an Adam's apple. This could become very important during extraoral exams. These are only a few of the common hard and soft tissue interventions that may be seen in the transgender community.
To help illustrate the ideas we've been discussing so far, we found a couple of case studies we'd like to share. This first case helps to illustrate the important role orthodontics may play for a transgendered individual as part of their gender affirmation process. This case specifically illustrates that interprofessional collaboration can be important to achieving desired treatment outcomes, especially in cases, such as this one, where a patient is taking medication that may interfere with the course of treatment and the desired outcomes in general. The first case study we'd like to discuss focuses on a transgender woman whose chief complaint was about the appearance of her teeth and her smile overall. With so many other aspects of her transition already completed, the patient felt that the feminization of her teeth would be the last piece of the puzzle in terms of her more feminine presentation. Although there were many different aspects to the patient's treatment, we'll be focusing on those that specifically address the patient's aesthetic concerns. After consulting with the patient about what her ideal smile would look like, a treatment plan was formed. This included softening the proximal incisal edges of her teeth and making her lateral incisors smaller in comparison to her central incisors. During the orthodontic phase of treatment, it was noted that the movement of the patient's teeth was going slower than expected. An orthodontist, in consultation with an endocrinologist, determined that it was one of the patient's medication that was causing the delay. Estradiol, a hormone replacement therapy the patient was taking, was interfering with the metabolism of her bone and, by extension, the movement of her teeth. After adjusting the medication, the patient's desired treatment outcomes were achieved, as we can see from her beautiful smile in the picture on the side there. Another note we'd like to highlight from this case is that the patient was grateful for the opportunity to share her preferred name with the clinician, as this helped open up the conversation of her gender history. The second case we wanted to highlight examines the implications of oral maxillofacial surgery in an individual's transition. In general, facial surgery is about much more than aesthetics, as it plays a very important role in improving the patient's health overall. Facial surgeries for transgender patients include any number of procedures, some of which Megan mentioned before, but mainly focuses on reforming the structures of the patient's face as they see fit, addressing hard and soft tissue concerns. It's important to note that, although we'll be examining a case about transgendered women, masculinization surgery also exists and could be sought after by transgendered men, although it was harder for us to find information about it. The bottom line is that both types of procedures have similar positive effects on a patient's health overall. It's also important to note that, while the referral must be completed by a dentist or physician, we could play a very important role in helping the patient get the process started, letting them know their options, and answering questions they may have about the procedures. The study we'll be discussing follows 33 transgender women who received a variety of different procedures, but will mainly be focusing on one individual. These radiographs are of that patient. While many of the interventions may be apparent from these images, such as reduction of the nose, chin, and forehead, a comprehensive list of procedures was not given, as the article simply states that she had gone full facial feminization surgery. These are obviously pre- and post-op images, and they were taken 4 years apart. These images were, just like the radiographs on the previous slide, taken 4 years apart pre- and post-operatively. It's a little bit easier to see some of the modifications that were made here, including reduction in jaw width and modifications to the nose. As important as it is to note the physical differences in pre- and post-op images, it's more important to recognize the significance of these operations to the patients. All 33 individuals said that the procedures that they had a profound positive effect on their ability to live as women and improved their physical, mental, and social functioning overall.
There are a couple of things we would like for you to take away from this presentation. Firstly, the increasing visibility of this population is very important. A patient who has always identified as transgender may now be comfortable disclosing this to you. So we need to know what we can do to best serve their needs and make them as comfortable as possible during this process. Advocacy for our patients is also incredibly important, especially those who are marginalized and at risk of slipping through the cracks. We can ensure our patients are heard and feel cared for. We as hygienists could be the ones to suggest new patient intake procedures in the office that more accurately reflect gender diversity. Being aware of the medications this population could be taking and the associated oral implications is extremely imperative. We as oral health professionals play an important role in ensuring our patients are able to achieve their treatment goals, maintain optimal oral health, and receive treatment in a comfortable, safe environment at every appointment. Just like with any other patient with specific needs, it is important for us to know how current health status may play a role in and affect their oral health status.
To conclude our presentation, we all need to keep in mind that it's extremely important to treat everyone with respect and to treat people the way that they want to be treated.
We wanted to leave you with a quote that spoke to us by past President Jimmy Carter. The bond of our common humanity is stronger than the divisiveness of our fears and prejudices.
We'd just like to say thank you so much for listening to our presentation. I hope we were able to give you some insight on ways you can be more inclusive when treating and caring for individuals of the transgender population.